It's my great pleasure to introduce Dr. Patrice Harris, a psychiatrist from Atlanta who is president-elect of the American Medical Association. Active in organized medicine her entire career, Dr. Harris has held many leadership positions at both the national and state level. She has served on AMA's Board of Trustees since 2011, including a term as chair from 2016 through 2017. She previously served as chair of the AMA Council on Legislation and on boards of the American Psychiatric Association and the Georgia Psychiatric Physicians Association. As past director of health services for Fulton County, Georgia, which includes Atlanta, Dr. Harris oversaw all county health-related programs and functions and spearheaded the county's efforts to integrate public health, behavioral health, and primary care services. Governing themes in Dr. Harris's professional life are a passion to improve the lives of children and service to others. A key priority for Dr. Harris is developing solutions to end the nation's opioid epidemic. Since 2014, she has chaired the AMA's Opioid Task Force and brings together specialty and state medical societies and other health associations to implement best practices to combat the opioid epidemic and save lives. Dr. Harris is a native of Bluefield, West Virginia. She has bachelor's and master's degrees in psychology and a medical degree from West Virginia University. I've had the pleasure of serving on the WVU Foundation board with Patrice. She is just an exceptional, caring, thoughtful, inspiring person. So please join me in welcoming a very special mountaineer, Dr. Patrice Harris.
Well, thank you, Bob, and thank you all. It's always great to come back home. I was walking a little gingerly there because about 2.5 weeks ago I fell. Not a great story. I wasn't skiing in the Alps or anything like that. I was just clumsy. And so I sprained my ankle, but it's getting better and it's going to be totally healed by the time I have to put on some dancing shoes in about another month or so in Chicago. But I am so honored to be here today to this celebration of community, of philanthropy, and of hope. And congratulations again to the awardees. Many of the programs are so close to my heart as a child psychiatrist, as a public health professional, as a West Virginian. So I want to also extend my congratulations to the awardees. It is truly remarkable that a community of this size has generated the philanthropic spirit to rank among the top 100 foundations in this nation. That's quite an achievement, and I implore you to really spread that spirit across the communities in this country. It's again wonderful to be back home in West Virginia. As Bob said, I grew up about 90 miles south of here in Bluefield, the heart of coal country. My father worked for the railroad, and my mother was a junior high school and middle school math teacher. In fact, in the 8th grade, we had just 2 junior high schools in Bluefield. In the 8th grade, I was in her class. Now, I had to decide, am I going to call her Mrs. Harris? I decided I was not going to do that. But I also didn't think it was appropriate to raise my hand and say, "Hey, Mom." So I just raised my hand. And luckily, it all worked out. And here's a little known fact. I was an elementary school cheerleader and later a cheerleading coach for the Little League. Actually, my dad was coaching Little League. Those were some great times. Now, perhaps some of you have heard that there's a movie coming out with Diane Keaton, Pam Grier, and Rhea Perlman called Palms. Have any of you? I think I've seen a couple of commercials. Okay. So these are seasoned women And apparently they start a cheerleading squad in their retirement community. Now don't worry, I don't see that in my future. My view is what happened in Bluefield stays in Bluefield. But I do treasure that time growing up in Bluefield. My father had 9 siblings, 6 of whom lived in Bluefield. So I had a bunch of cousins, and every Sunday we went out to my grandmother's house. We called her Big Mama. I don't know how many of you have a Big Mama, but we went out to Big Mama's house. And I really treasure that time and that community spirit in Bluefield, and of course the community spirit we have here in West Virginia. When I was in high school, my father took me to Morgantown for a football game. We were there particularly to see Dwayne Woods. He hailed from Bluefield, and he played for the WVU Mountaineers, and I fell in love with WVU that day. And so I decided to go to WVU. I eventually, as Bob said, earned my psychology degree, my master's in counseling from WVU, as well as my medical degree. Now, I did my last 2 years of medical school here in Charleston. Actually, right down the block was my very first rotation on trauma surgery. And I hope this isn't too graphic a story to tell. Jack, I don't know, what do you think? But I have to tell you, as a third-year student, you wake up in the middle of the night when your beeper goes off. And so it's your first, at least then, we spent the first 2 years in clinical care, in basic sciences, and then the last 2 years of medical school in clinical care. So I decided to do surgery as my first rotation. I wanted to at least optimize the chance that I would see daylight. And so I remember going downstairs in the middle of the night, one of my first trauma calls, and I stumbled my way to the emergency department, and there was a woman who had been in a motor vehicle accident, and she was in cardiac arrest. And in an attempt to save her life, we had to open up her chest. And I remember one of the residents telling me to put my hand in her chest and massage her heart, because that was the only thing that was going to keep the blood flowing until we got her to the OR. And I remember knowing at that moment the power and the privilege of being a physician, as well as an appreciation, a deep appreciation of the fragility of life, but that the hope that I, as a physician, and everyone who's in the healthcare community can offer to save lives. And so that was a very special connection that I learned early on in my medical school training. My enthusiasm for WVU, though, is legendary. Again, wonderful experience, undergraduate medical school, and the awesome opportunity I just told you about. But on the lighter side, my enthusiasm for WVU runs deep regarding our football team. So much so that my friends know that anytime the Mountaineers are playing, they should not call. And that if I can, I'm probably traveling to where my beloved Mountaineers are playing. At the AMA, I get the opportunity to interact with, of course, physicians from across this country, particularly the physicians from Oklahoma. And they know what a great fan I am. And one of the physicians, I went to Oklahoma once to talk about the AMA's work on the opioid epidemic, and she presented me with an Oklahoma Sooners hat. So at the next AMA meeting, I presented her with a Mountaineer hat. So we're all good. For the past 20 years or so, I've lived and practiced medicine in Atlanta, Georgia. And I have to say, as you know, I love my home state, but the weather's just a little bit warmer in Atlanta. But I do come back to West Virginia every chance I get. And again, part of what I come back for is that West Virginia spirit. I bet you I share this experience with most of you in this room. Every time we lock arms and sing Country Roads, I tear up. And only my fellow Mountaineers can really understand that. But next month, as noted in my introduction, I will begin serving as president of the American Medical Association, the 5th woman, the 174th president, the first African-American woman. And I am so proud of that and bringing West Virginia to that. Thank you. Oh, and I learned last night in our conversation the third West Virginian. So hey, that's yes. So that is certainly a tremendous privilege and a role that I am very much looking forward to. Let me tell you a little bit about the AMA, because I think some people, it's sort of a nebulous organization. It's the largest and the oldest association representing physicians in the United States. We have a 170 plus year history of establishing ethics for the practice of medicine, improving medical education, and taking on difficult public health challenges. Our policymaking body is called the House of Delegates. You can think of it as sort of the Congress of Medicine. We have delegates from over 190 specialty and state societies. We meet twice a year to establish policy regarding health, medical, professional, and governance matters. Now, some of you may seem, and it does sound a little like inside baseball. So you may ask, what does that mean to us? What does that mean to me? Turns out, a lot. Policy adopted by the House of Delegates has helped lead to major public health achievements: seatbelt laws, strong vaccination laws, and by the way, West Virginia, I am so proud that I can say this, that West Virginia has one of the strongest vaccine laws in this country. Yes. Policy outlawing discrimination against HIV and AIDS patients, and really our longstanding commitment to improving access to health insurance for all Americans. And as you know, we were strong supporters of the Patient Protection and Affordable Care Act. And I know that many West Virginians now have access to affordable coverage because of that legislation. And so the AMA is now building on that decades-long commitment to the public health with several major campaigns. First, we are taking on chronic diseases such as diabetes and heart disease. Too many Americans and West Virginians are struggling with these conditions. I don't have to tell you all that. And again, West Virginia has some of the highest rates of death from diabetes and heart disease in this country. And so at the AMA, and I appreciated what our nurse colleagues were saying about the area of prevention. At the AMA, we want to do more to prevent these conditions from occurring in the first place. We are focusing on the precursors to these diseases: prediabetes and high blood pressure, which, if left untreated, as we all know, progress to heart attack, heart failure, kidney failure, loss of limb, loss of eyesight. Much of what we are doing in our work is expanding awareness among the medical community, but also among the public. We are working in partnership with the CDC, the American Diabetes Association, and the Ad Council to expand awareness of prediabetes through an advertising campaign. Hopefully, some of you have seen some of our ads. We try to use humor to connect to the public. But if you have an opportunity, we are asking everyone to view our website, doihaveprediabetes.org, and take a risk test. And then we are asking folks to take the results of that test to their physicians and discuss how to prevent diabetes. We are also working with the American Heart Association on a project called Target BP to urge physician practices, our nurse practice colleagues, and everyone, health systems and patients, to prioritize blood pressure control. We know a significant number of folks are walking around this country with high blood pressure and they don't know they have it. And also we know there are folks who know they have high blood pressure, but it remains uncontrolled. And again, significant effects and impact of walking around with uncontrolled hypertension, stroke, again, kidney disease, loss of limb and sight. So we launched a public and physician-facing messaging campaign around the new hypertension guidelines and create new tools on a website called Target BP. And I have to tell you, we also wanted to make sure that everyone knows how to measure your blood pressure. And so when you go in to see your physician, try to get there a little early. We all know it's a little anxiety provoking sometimes, even for me, even for physicians to go to a physician. Try to get there a little early so you can take a moment, so you're not rushing in, so that you can be seated with your arms to your side, both feet on the floor, so that you can have your blood pressure measured accurately, so that you and your physician and other members of the healthcare team can design a program that really matches your needs. So I'm sure you will agree that prevention is the future of healthcare. We must do more to reduce the stress and the burden of chronic disease on people, their families, and our communities. And in doing so, we can reduce the financial and the resource burdens on the American health system. I know you all see the slide where we spend X amount on medical care or health care with these results. We all know that data. And so we need to make sure that we are doing whatever we can on the prevention side to reduce not only the health effects, but also the financial impact, so that then we can use that money on other things like education and infrastructure growth. So as you can see, it all works together. Another top priority for the AMA is addressing the opioid epidemic, which again, I don't have to tell you, has hit West Virginia especially hard. The premature loss of life due to this epidemic is just tragic. This epidemic is personal to me. I know I'm not alone in this room in the fact that my family has been impacted by this epidemic. And I've seen the effects of this epidemic up close and personal, and seen the impact on families and patients who struggle with substance use disorders. So in addition to my role as president-elect of the AMA, I also serve, as Bob said, as chair of the AMA's Opioid Task Force, a group of the 25 or so national, specialty, and state organizations, including also the American Dental Association. And the purpose of that task force, we wanted to demonstrate a couple of things. We wanted to demonstrate physician leadership on the issue, and we also wanted to identify opportunities for partnership and collaboration in addressing the opioid epidemic. And so we are urging physicians to enhance their education. We are supporting comprehensive treatment for patients with pain and for those who have a substance use disorder. We are working hard and in partnership with communities to reduce stigma. And we are working hard to raise the level of awareness around naloxone, which, as you know, is the overdose reversal medication. We want to make sure that every community has access to that life-saving medication. I heard, and I'm not sure if she's here today, one of the grantees talk about the fact that we can't treat or work with folks who are not alive. And so it's very important to expand access to naloxone. The good news is we are beginning to make some progress. There are fewer prescriptions. The number of prescriptions have been decreasing. Treatment capacity is increasing, although not enough. Physicians are enhancing their education, and access to naloxone is rising. The task force will be issuing a new report in the next few weeks, and that will have updated numbers and really some new thoughts about how we can partnership with, again, external stakeholders. But based on what I saw yesterday, you are leading the way, members of this community and this foundation working together to address the opioid epidemic. Physicians cannot do this alone. I do believe I'm preaching to the converted on this, you in this audience. There are those social determinants of health that we need community help to address. Addressing poverty, addressing education, addressing lack of employment, addressing homelessness and what we call housing insecurity, addressing food insecurity, and really helping our fellow citizens make healthy choices. You know, it's very easy for me as a physician to say, hey, I need you to eat better. You know, I need you to eat healthy, nutritious foods. But if you live in a neighborhood where you don't have access to healthy, nutritious foods, how do you even have the opportunity to make that choice? As a physician, I may say, I need you to increase your activity. And by the way, you see me wagging my fingers. As physicians, we might do that a little too much. And I read an article in the New York Times every day that said, doctors, that physician wagging, that finger wagging is not helping. But again, I can say, please increase your physical activity. And I can say, you know what? You don't have to join a gym. You don't have to have an expensive club membership. Just walk around your neighborhood. But if your neighborhood is not safe, if it's not well lit, if there are no sidewalks, that is not an easy choice to make. And so together, we all have to work to make the right choice the easy choice. We have to make sure that we impact those social determinants of health, because you all know that having access to healthcare is just the beginning. It's necessary, but it's not sufficient. So the AMA is cognizant of social determinants of health as our overall strategy to improve health outcomes and to increase health equity. We have to talk a little bit about health equity. I'm very excited that the AMA is about to embark on what I call our Health Equity 2.0 strategy. We just hired Dr. Aletha Maybank. She's a pediatrician and has worked long and hard in health equity. And so we're very proud of that fact. But again, all these reasons are why your work here at the foundation is so vitally important. You are making good on your vision to be forward thinking, to be closely connected, and to work together to promote the health and prosperity for all. Now, the advantage you have is you are here in this community. I'm sure many of you remember Speaker Tip O'Neill saying, all politics is local. Well, I like to say all healthcare is local. Now, absolutely, we need Congress and we need state legislatures to fund adequately the appropriate infrastructure so that we can do our work. But really, solutions need to come from the bottom up, from the ground up, because who better knows the community than the people who live in the community? And so you have that wonderful advantage, and I have to say you are taking advantage of your opportunity. The stories of impact you've shared on your website make that clear. You have the ability to see a need and respond to it directly, right away, because oftentimes folks in need of health care cannot wait. For example, just a few of the programs that I saw on your website. You all know about our struggle as a country, but here in West Virginia, with overweight and obesity. It often starts in childhood, and that's why the Keys for Healthy Kids partnership helps child care centers create natural learning environments, promoting gardening, and I like that. You know, kids, you're teaching families and kids that they can grow their own healthy, nutritious foods and outdoor play. We know healthy habits begin early in life, and that is exactly the kind of experience children should be participating in. When I was health director at Fulton County, we built a facility that had a teaching kitchen. So we wanted to teach folks how to prepare. Because listen, when I went out to my big mama's house, I can tell you that we had some fried foods and some stuff that was, seasoned with a little bit of lard and a little bit of bacon. And we have to teach the next generation of folks to prepare those foods more healthily and that they taste good. We did a project one day in Fulton County, and I overheard one of the kids say, I didn't know broccoli could taste so good. So that's what we need to continue to do. We know that many women, particularly single moms, struggle to provide for their families with limited income and employment opportunities, and that's why West Virginia Women Work is training women to become economically self-sufficient, often, and I love this, in non-traditional occupations such as construction and trades. We know that children, no matter what their neighborhood, benefit greatly from exposure to the arts and live performances, and what a great facility this is. Plays, concerts, ballet, important to building community spirit. And that's why programs like Ticket Town and Festival All pay for discounted tickets for children to attend live performances. These programs help pay for transportation and a meal for the kids. Seemingly small gestures, but I know you know, and I can tell you make a big difference. So there are literally hundreds of small charities here working to make the community a healthier, safer, and even more playful place. For example, the Jerome H. Deutsch Memorial Fund assists after-school programs, homeless programs, and the medically underserved through the work of Health Right. And I have a personal connection with that family, and I'll be happy to share that with you at the reception. These charities demonstrate an important truth. Donating, as was said earlier, your time, your talent, and your treasure can make a difference. All it takes is a small group of committed individuals or family who are willing to share their resources. And it takes a buy-in from the local community, a willingness to participate. So I believe, and the AMA believes, that we can create healthier, more prosperous communities. How? By joining together, as you are doing and as you are demonstrating. By each person doing what he or she can. By each organization doing what it can in partnership and true collaboration, as one of the awardees said, with others. So let me leave you with words that you have heard often, I'm sure, but bear repeating. Words by Margaret Mead. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So thank you all for changing your corner of the world, my corner of the world, and for serving as an example to other communities across this nation. Thank you very much.
Go too far, Dr. Harris. Well, there is an award that our state presents to West Virginians of distinction and honor, and we found out that Dr. Harris had not yet received this award. So through James finagling, we have today the opportunity to present Dr. Patrice Harris with the Distinguished West Virginian Award.